Good afternoon, everyone. We are going to get started in about 2 minutes. So, as a friendly reminder, please mute yourself and turn your video off during today's presentation. Additionally, we will be uploading a recording of this webinar along with the slide deck and resources to louisianabelieves.com. All right, good afternoon, everyone. I have 3:01, so we're going to go on ahead and get started. I'm Meredith McGovern, and I'm with the Office of College and Career Readiness with the Louisiana Department of Education. And today is September 3rd, and we will be hosting our school operations and reopening office hours. During this meeting, make sure that if you have any questions, you submit them via the online chat feature. By submitting them this way, we are able to moderate our questions and add them to our FAQ document, which is updated weekly. We are going to be extending our Strong Start reopening office hours through September. There is an updated Zoom login information for the upcoming office hours. It is on this slide, and it will also be in next week's newsletter. So please make sure that you pay attention to that as we continue to support our schools as we reopen and get ready for a strong start for the school year. As a reminder, the purpose of these calls is for school system leaders and support staff to hear the latest updates on policies surrounding school reopening. So as normal, our weekly call will begin with an overview of recent updates, followed by a moderated Q&A session where you have the opportunity to submit your questions via chat. As a reminder, our resource documents that we've provided for Strong Start reopening are our guidelines, which include the baseline public health requirements, our best practices, our FAQ document, which is updated weekly. And today's agenda is going to cover our assessment update for LEAP 2025 for high schools, an update on the vision hearing screening proclamation, a discussion on the LDH early warning system from Assistant Superintendent Ken Bradford, along with some updated guidelines for LHSAA spectators. We will wrap it up with an update from the Children's Hospital of New Orleans, who have partnered with us this school year to support our schools as we seek to reopen safely. And we have Assistant Superintendent Ken Bradford on the call, and I'm going to let him make some opening remarks, and then I believe he will be turning it over to Dr. Finger to give us an update on COVID-19 in Louisiana.
Yep. Thank you, Meredith. This is Ken Bradford, Assistant Superintendent with the Office of Career and College Readiness. We thank you for joining today. So I'll be very brief. I'll turn it over to Dr. Finger for some opening remarks on our COVID updates, and then we can jump right into the agenda and make the most of our time today. Dr. Finger, at this time, I'll yield the floor to you.
Yep. Sorry, Ken. I was having some audio-visual difficulty. I appreciate it. Thank you all. Just a quick update. Again, case count is slightly increased since we last spoke last week, around 150,000 across the state, with just around 9% of those being pediatric patients under the age of 18. What we have seen, the overall percent positive continues to decrease across all regions, but in some areas of the state where there are universities who are doing more and more frequent testing of the students or college age personnel, we've seen increased case numbers identified simply because more cases are being tested overall. That has not actually affected the overall percent positive rate, and that number still continues to trend down. Again, we do know that there's been a lot of disruption in the southwestern part of the state in particular due to the storms of last week, but have not seen an overall bump in total case volume since then. So that makes us feel good. Other than that, nothing much new since last week in the overall process. I know many more schools are returning to in-person learning. As people work out their operational systems, they're finding out what works and what doesn't and making adjustments on the fly. But thus far, the feedback that we've gotten for the schools that have gone live is that although it's challenging, it's been manageable. And there is, it's been, the families are engaged, educators are engaged, and students have been engaged. It's been a thus far relatively positive feedback from across the state for those schools who have returned to in-person educational opportunities, Ken. I know we've got a lot to get to so far, so I wanted to make that brief and leave a lot of time for a Q&A at the end.
All right.
The one thing I know that Ken did allude to the Louisiana Department of Health early warning system. I've just been made aware recently that came out. I know Ken is going to give you some high-level guidance on that. That came from the state medical officer, not the Department of Education. And both the Department of Education and myself and the Office of Public Health will continue to work and see what we can do to help make that process easier and more streamlined and helpful to everyone on the phone. Thanks, Meredith.
All right, thank you, Dr. Finger. And as always, we are incredibly grateful for the partnership and the resources that Children's Hospital have provided us throughout this summer and this upcoming school year. So once again, thank you so much for your help. All right, let's get started so that we have time for a Q&A at the end of this. We wanted to let everybody know of an update that was issued in last week's newsletter regarding Fall LEAP 2025 high school assessment and the administration of those exams. The Fall LEAP 2025 high school assessment administration is currently scheduled for December 1st through 18th. However, in response to the delayed school openings due to COVID, a second window has been scheduled for January 6th through the 26th, and school systems will be asked to submit their choice of window to the department in October utilizing DRC Insight. Additional dates and reminders will be forthcoming from our assessment team, so make sure that you pay attention to that in our newsletter. And as always, we will try to highlight them on our reopening office hours. Real briefly, we spoke, I believe, 2 weeks ago in our last reopening office hours. We had Ashley Politz with the Louisiana chapter of the American Academy of Pediatrics. And we committed to working with them and the governor to work on an emergency proclamation surrounding vision and hearing tests. And we are happy to report that Governor John Bel Edwards recently issued his state of emergency proclamation number 111, which includes the following statement: that the provisions requiring that vision and hearing tests be done within the first semester of the school year are suspended. School districts are instructed to continue such tests as much as possible, prioritizing students who have not been previously tested. And the provisions of those proclamation are effective from Friday, August 28th, 2020 to Friday, September 11th, 2020, or as extended by any subsequent proclamation unless it's terminated sooner. And as a reminder, the Louisiana American Academy of Pediatrics issued a memo outlining an updated recommended schedule. And their recommended schedule was that pre-K and kindergarten students should undergo the vision and hearing screening, and any student with a reported concern or students for special education, title, or SBLC request shall undergo a vision and a hearing screening, whereas the other grades will have those suspended until it's safe to do so. So we are grateful to our partners at the American Academy of Pediatrics for working with us, as we know that was causing some concerns. Now I'm going to turn this back over to Assistant Superintendent Ken Bradford to give us an update on the Louisiana Department of Health early warning system.
Thank you, Meredith, and I'll take us through. I have 3 slides here to go through right now relative to the early warning system. So it's Superintendent Brumley had messaged to some superintendents earlier in the week that we were expecting a forthcoming emergency order. And this week, yesterday, the Louisiana State Public Health Officer, Dr. Jimmy Guidry, he did issue an emergency order that allows for the Department of Health, in consultation with the Department of Education, to develop an early warning system for COVID-19 in our Louisiana schools, both our charter schools, our non-public schools, and our public schools. It's created to aid schools and the public health officials in monitoring and mitigating for potential school-based outbreaks. Participating in the initiative will provide schools the guidance on what information to collect in the event of a COVID-related illness in your school facilities. It's also going to allow you to collect case information in one centralized location with the ultimate goal of keeping all of our students safe. Information that is going to be submitted in the system is going to be critical for school-based contact tracing and helping schools in decision-making if they would have to close. Information reported in the system will also be available to the state public health officials, which is allowing for the ability to lend assistance where needed. And again, I'm looking at a copy of the order. The order from the State Public Health Office was issued on September 1st. It's order number 2020-COVID-19-001. And this is the emergency order for school reporting and data sharing order. The resources that the Department of Health has developed to help you navigate and implement this initiative of case reporting includes 4 things that are linked here that you'll be able to go to. We will have this PowerPoint posted this afternoon. Number 1, it's the guide for school reporting, which is like a technical manual on how to get your system up. A COVID schools worksheet, a school contact tracing guide, and a contact tracing worksheet for parents. For more information, you can visit the COVID-19 Resources for Schools website. Inquiries related to the COVID-19 spread in the school setting and the reporting system process should be directed to the following Department of Health email address, and that's schoolcovidreporting@la.gov. That would be for things like technical assistance for getting your reporting system up and operational. If you have username, password issues, etc. If you have questions about functionality of the system, those are where those emails should be directed. This system takes the data and it goes directly from the school site to the Department of Health. The Department of Education does not have any technical contributions to that. It's an electronic system. It goes directly from the individual unique school site to the Department of Health system. What we've committed to, and we've been in discussions with the Department of Health today, subsequent to this order, is that we're going to continue working with public health to facilitate additional technical support opportunities for school systems, additional tools, and additional resources to make this an effective system so that can help aid you in your decision making. The next item that I had that we have in here, we have been getting lots of questions relative to spectator guidance for our student athletes, for our parents, etc., who may be participating in athletic events. As many of you are aware, this week volleyball has begun the fall volleyball season. And although those student athletes are staying in a group of 25, we've received multiple questions about the seating for attendance. Should the parents want to come, guardians, etc., want to come and watch those athletic events? So we're here today to share with you that outdoor and indoor spectator capacity for the High School Athletic Association sanctioned athletics should be set in accordance with the Louisiana State Fire Marshal guidelines that have been developed with the Office of the Governor and the Department of Health. So you can go to the opensafely.la.gov, and in there they have guidance on spectator seating for gymnasiums, spectator seating for outdoor venues such as like football stadiums, etc. As an example, like the outdoor venue, for example, has 50% seating capacity in phase 2. It talks about families in no larger than a group of 10, 6 feet of social distancing, nobody sitting near the aisles closer than 6 feet, etc. So again, if you're one of those schools that has a volleyball team, you've started your volleyball season, and you are asking about how do I configure my gymnasium such that it's meeting state public health standards, state fire marshal guidelines for those parents that want to come to the game, that is now available, and it can be found at the opensafely.la.gov. Meredith, with that, I'll turn it back over to you to discuss supports from our key partners with Children's Hospital New Orleans.
All right, thank you so much. As a reminder, our big partnership this school year has been Children's Hospital of New Orleans. They are running a hotline for school wellness and virtual care that offers guidance to school nurses and school administrators. Additionally, they are continuing their town hall series for schools throughout September. We have a new time of 3 p.m. and the Zoom link and information is available in our weekly newsletter, along with on the next slide. So we have 2 more dates coming up, September 15th and September 29th. We had one this last Tuesday, and it will be uploaded to our website shortly, where they reviewed a new decision-making tree that they have worked with the Louisiana Department of Health to develop for schools to figure out how to handle reported COVID cases. So as always, we are incredibly grateful for this partnership with Children's Hospital. As a reminder, they have a school wellness page that has resources for school systems to use. It includes printable school signage to remind students and visitors of social distancing measures, hand washing hygiene, and facial covering use, along with parent resources for schools to share out regarding communicating COVID issues with parents in the classroom. As that's all for all of our new information, we would like to review something that we've received several questions about. So as a reminder, the facial covering update is that the CDC recommends that people wear cloth face coverings in a public setting and when around people who do not live in your household. Cloth face coverings are what is recommended as the barrier, and they do not recommend the use of gaiters as a substitute for cloth face coverings. Therefore, we are strongly recommending that neck gaiters should not be used and are only a last resort until you can achieve or procure an appropriate cloth face covering. I'm not sure if Dr. Finger has anything to add to this, as I know he has commented before for us on the use of neck gaiters. So I will give you an opportunity and maybe a demonstration of how to effectively wear your face mask.
Meredith, thank you. I think your comments on gaiters are still the going word, is that we're strongly recommending wearing a cloth face mask as opposed to a neck gaiter. Right now I have a cloth mask on. You can see it covers my nose and mouth. So I think that's still the recommendation from not just the CDC, but the Louisiana Office of Public Health.
All right, thank you so much for that. And I think that's the end of our updates and our reminders for our slides. So I'm going to see if Ken has any questions that have come into the chat that we need to answer. And as always, if you do have any questions, please make sure you drop them in the chat or you email them to LDOE COVID-19 support@la.gov.
Yes, Meredith, if it would be helpful if Dr. Finger could just speak to, if he could, a little bit more about the mask. They're asking for some additional clarity one more time about the net gaiters, and then also what about a valve mask? What is the latest on those?
Yeah, still valve masks are not to be worn on campus. I think that's something that does an ineffective job of keeping droplets within that own individual's airspace. So no valve masks. I think the last time we saw it, I don't think that recommendation has been updated. So no valve masks. And the second part of your question, Ken, was?
Yeah, they were asking again about the net gaiters. If they double folded them over, was that appropriate, or should they still seek cloth face coverings?
They should still seek cloth face masks. Again, I think I want folks to focus on the 98% of the people who are going to be doing this correctly, and not on the couple who might, for a brief period of time, have a gaiter. The problem with the gaiter is that the thinness of the material, and there's just a concern that I recognize might be hypothetical, that it doesn't do a good job of keeping those air particles on the users in their own user's face and could actually disperse them. Again, the CDC has not come out and explicitly banned them, but their wording has been strongly recommending wearing cloth masks. I think everyone should try and do the best that they can to manage that situation. And I recognize that it's challenging with such a large swath of the population over a wide age group.
Yeah, thank you, Dr. Finger. I have another question too. And this is about when students go outside for a recess break, if they are maintaining 6 feet of physical distancing, can they take off their mask for a quote unquote breather break?
Yes, I think that's quite appropriate. I think we ask that if they're doing aerobic exercise and they need to remove the mask while they're outside and being able to socially distance, that's still okay. The declaration that was recently made does include physical education as a public activity where there's a mandate to wear masks, but with the recognition that if someone needs a break or they're doing hard aerobic activity, that it can be removed, with the stipulation that we still maintain that physical distancing as previously discussed.
Yeah, thank you. I'm looking through, give me a second to look through these. What about students that test positive and then they quarantine, they recover, and they return to school, and then they have a different illness, perhaps like a strep throat or a flu? Do they treat them as COVID positive?
No. So you'll see when we share, so it depends the time frame that you're not treated necessarily as COVID positive unless either you test positive or there's a strong history of a known exposure. Okay, otherwise you'll follow the algorithm for someone who's symptomatic. Okay, however, if Johnny has been diagnosed with COVID-19 on September 3rd, and in October he has a fever and a sore throat, he can still have a diagnosis of strep throat. Okay, that's completely within the realm of our evaluation.
Relative to temperature checks at the school, the question is, are they still required to do those? And I can answer that one, Dr. Finger. There has been no change to the policy that students have an initial temperature check. I think with the second half, Dr. Finger, maybe you can help here, is it recommended that they also take a second temperature check after 5 hours, or is one time in the morning appropriate?
One time a day is appropriate. I don't think,
No, go ahead.
yeah, one time a day temperature check is appropriate unless there's a change in the student's condition.
Yeah. The for an individual that a face covering, they can't find one that fits snug and good and appropriately. Can you talk about wearing the face shields and how a drape would play into place with that?
Yeah, I think that's an individual school leaders going to have to help do that. We've seen that done a couple of times across the state for people with some sort of medical condition, and they've been able to wear a face shield and attach some sort of a drape that extends from the bottom of the face shield down. It's still not as perfect as a cloth face mask because there is a little bit of distance, so it certainly shouldn't become widespread, and I think is a little bit difficult to navigate with how that exactly works. But we've seen a couple of folks in very specified individual situations do that.
Yeah, thank you. Give me a second to scroll through. I have a couple more. Lots of mass questions today. If an individual has had COVID and they have recovered, are they still required to wear a face covering? And if so, what is the medical rationale for that?
The medical rationale is that we're still unclear of whether or not there can be transmission, not just transmission, but if they might be susceptible again. The current thought is that there's likely some degree of immunity that's conferred with that COVID-19 infection. But again, we're only 6 months into the pandemic and are still learning about
it. The next question is about bus transportation. And I think I know the answer, but you should validate this for me, Dr. Finger, because I know we've answered it before. It says, can children from different households sit in the same seat on a bus if they are wearing masks and are sitting together for less than 15 minutes? Actually, I'll defer that to you. I know that what we've talked about is the students from the same household, they can sit together. But this question here is, can children from different households sit together in the same seat if they're wearing a mask and they're sitting together for less than 15 minutes?
Yeah, I think to the extent possible, we would try not to do that. But again, if it's for an incredibly short duration and that's what the capacity of the bus allowed, obviously that would be tolerated.
Thank you. I'm getting a few, I've had 3 or 4 very, very specific, very in the weeds questions relative to the Department of Health's early warning reporting system. And again, and folks are asking, where is it that they can get a copy of this guide? And I think the easiest way for you to be able to get a copy of this guide is what we will do is we will post today's presentation on the department website. Immediately following this call, I will work with Meredith, who is our facilitator today in our communications department, to get this PowerPoint up. And what that's going to allow you to do is to go in to today's webinar and click on those resources that we've talked about. And again, a lot of the questions are coming in about the that are really technical in nature about the tool itself. And one of the things we link to out of this PowerPoint is a guide for school reporting. And they have attached with pictures on how to do several of these steps, they've attached a 14-page user manual. And so we'll post this PowerPoint, and then you can go in and look at that user guide. And if you still have further questions or need that technical assistance on that reporting system, you can email that LDH address we've provided on slide 12 today, which is schoolcovidreporting@la.gov.
Okay.
And last question for you today, Dr. Finger, will be, can students sit closer than 6 feet if they use individual plastic barriers or partitions?
So does that mean sort of plexiglass that is placed between the seats and extended upward? I'm just asking a clarifying question.
Yes, and I'm not sure that it is, if it's even referring to a bus, perhaps even in a classroom. So can students be closer than 6 feet if there's a piece of plexiglass? Let's say in this case, let's use plexiglass. If there's a plexiglass as a plastic barrier between them, what is the recommendation on that?
Yeah, as long as the plexiglass raises above where someone would stand. So I think it would probably need to be greater than 6 feet, depending on the size of the students. I think that's a safe thing because it extends higher. I will say there's not a strong recommendation about that specifically, although we have been asked that before. And as we've tried and define best practice with our colleagues, not just at the Office of Public Health, but at the CDC, I think that the thing that hamstrings it is it just can't be something that comes up to shoulder height, because that's not going to be effective at all.
Right. Thank you. I'll take the last two here, Meredith, and then turn it back over to you because these will be the last two. I have a question here about the guidance for the LHSAA events. And so the question is, did I say you could have spectators at volleyball games or when football resumes at football games? And the answer to that question is yes. We have put that guidance out there today. That was on slide 13. And if you go to the opensafely.la.gov email account, you will see there the State Fire Marshal's office, in consultation with the governor's office and the Office of Public Health, has issued spectator guidance for sitting in either indoor gymnasiums and or those outdoor venues like a football stadium. They're there. They even have, I was looking at them last evening. They even have diagrams in there. So those are available.
So Ken, just let me make another comment on the plexiglass question.
Yes.
I think, I think they can be effective. However, if one of those two students were found to have COVID-19 positive illness at some point, I think it would be challenging for the Office of Public Health not to declare a student who did sit within 3 feet a close contact, because it would be impossible for them to come on site and look at all of those school setups. That being said, I do believe that it's going to offer a higher degree of protection than if the barrier were not there. So I give that to you just with a grain of salt, giving you the reality of the world that we live in. The Office of Public Health will understand that is probably likely to offer some degree of protection, but it will be challenging for them not to declare a child who is within 6 feet of close contact in that specific situation.
Yeah. And two things in closing. We're being asked, will we be providing a support presentation for the technical support presentation for the LDH reporting system? And that is something that we have committed to, is that we will continue to work with LDH to be able to provide you with those type of presentations. So yes, we are in dialogue with LDH. We have communicated to them that our desire is to help facilitate a technical support session on the early warning system reporting system. And finally, there's a question here about about the LHSAA and their guidance that was out prior to today about spectator seating, and I can just say that yes, I was in contact with Mr. Bonine today around 1 this afternoon, and I alerted him to the fact that we would be sharing this afternoon with you all about the LHSAA spectator guidance, where you could have spectators at these events if it was abiding by the state fire marshal guidelines at opensafely.la.gov. Again, this is on slide 13 from today's presentation, and we will post this this afternoon. We will work with our communications team to get this up.
All right, Ken, I've gotten about 12 to 15 individual questions to me privately on the chat about the Gator question. And I just want to clarify, we're given as the CDC recommendations and Office of Public Health recommendations evolve, we update the community. So I know it's challenging, and we'll continue to be transparent in how those are given. So I just wanted to clarify, we're working as best as we can to work with the evolving recommendations that occur. I'm sorry I can't reply to all 12 or 15 individually right now.
Great. Okay. Well, thank you, Dr. Finger. I would also like to thank everybody for joining today. We had a very large crowd today, almost 300 individuals participating. We've recorded the webinar. We will get that uploaded. We usually get that uploaded by the next day. This evening, we'll work to get the PowerPoint uploaded, so you'll have it available and you can find those resources. So thank you for joining today. And Meredith, that concludes today's presentation.